Hi, my name is John Wiggins, and welcome to the moderator. Today, we are going to be talking to Dr. Howard Young and Sameerah Ali, who is a family nurse practitioner, and they are going to be talking to us about integrative and functional medicine. Hi,
Hey,
how are you doing today?
doing well yourself?
I'm just great. It's great to have you on the show. First of all, I would like to get a little bit of background information from the two of you. We will start with Sameerah Ali and see if she can give us a full background report of how she got started and becoming a family nurse practitioner.
I started my medical career as a nurse. I was a medical assistant, a nurse's aide, I was an LPN, then I went and got a 2-year degree in nursing,
Hmm.
and then finally I went back to get my advanced practice degree as a family nurse practitioner.
You also did a stint in the military.
I did. I was in the Army, and I was an LPN there, and I was in the Army for 5 years as
Okay.
a practical nurse.
So what got you interested in becoming a family nurse practitioner?
Well, I always liked healthcare, and I wanted to practice independently. And
Hmm.
so the advanced end of the nursing profession was nurse practitioner, so it was a natural progression.
Okay. And have you been enjoying this particular field of?
I do. I was trained in conventional medicine,
Mhm.
but my postdoctorate work was actually, postmaster's work, I should say, was in functional medicine. So it's a nice bridge between the two.
So what does a family nurse practitioner do?
A family nurse practitioner in the conventional setting, and I practice this as well, operates as a primary care provider.
Hmm.
So I can do physicals, exams, I can prescribe medication, just like a primary care doctor would. But our
Okay.
emphasis, what differentiates us from an MD per se, is that we focus on more education. And that's the part that I really like.
Okay. Well, thank you. And Dr. Howard Young, you want to give us a little background information about yourself?
Yes, thank you, John. I have to begin with an early beginning as a psychologist. I did work in the psych field for a number of years. I don't want to tell my age.
Okay.
I was an individual, marital, and family therapist for a number of years, and became too taxing. And I had two good friends who were psychiatrists, and they suggested that I should go back to school and reiterate and change my thought about what I'm doing.
Mhm.
So I went back to school and decided through some advice and advice giving that I should go into natural medicine. So I obtained a degree as a naturopath and also a PhD as we call it speculative philosophy, but it is really metaphysics. And that brought me to opening a practice in Nashville some 17 years ago.
Okay.
And working as a natural physician.
Was it a big transition, a change for you to go from one to this new one?
It was quite a transition, and I must mention in this, and I always give credit to a person who helped me along the way. Dr. Harry Bonner was really my mentor and helped me along the way. Being that seeing people from a natural perspective, he had the foundation, he had his own office, so I was a practitioner in his office, and that gave me a good start.
Okay. Sounds like you had a lot of information throughout the years being changing hands. But when you went from psychology to, you said, metaphysical,
Yes.
how big a jump was that, and how did it impact you when you make the changes, not only mentally but physically? Did it change the way that you felt about medicine altogether?
Yes, one of the things about being a psychologist and a therapist was you're dealing with people, of course. So to go back to school, I was talked to or advised, let me say it that way, from a psychological perspective to maybe stay in the psychological field. And metaphysics came up, as I said back then, it was called, and my degree is in metaphysics, but it's called speculative philosophy.
Okay.
So adding to that, I wanted to see people from a medical perspective. So it was brought into play that I should do 2 degrees.
Okay.
So in starting with the metaphysics, I went on into finishing with a degree as a naturopath.
Okay.
So it was first PhD and went on with the ND.
Okay, that sounds like a very interesting subject matter to talk about later also. But today we're going to be talking about integrative medicine and functional medicine. And what I want to ask first of all is, what is integrative medicine?
It's a good, very good question to ask, and it's most misunderstood when you look at where I was actually working in a, what we call conventional doctor's office. I was needed because when we did actual assessments, and we'll call it assessments on the patients, I was able to see some 80% of the patient load in this, in Dr. Burnell's office. So I became more focused on diabetes. And because many of his patients were diabetics, then I'm seeing more diabetics, and finally I'm seeing hypertensive patients, cholesterolemia patients, on and on. But all of those patients are connected to servicing them through natural means rather than conventional means.
Okay. When you say natural means opposed to conventional means, is there a difference?
There is a difference. Integrative medicine focuses on alternative therapies like aromatherapy and acupuncture and yoga and meditation, things that aren't focused on just drugs and surgery. Conventional medicine's focus is usually on those two items, drugs and surgery. So when you go into we used to call it alternative medicine, now it's more integrative medicine. You use a variety of modalities to treat the person. And generally it's not a formal diagnosis. They won't say, oh, you have this. They say, oh, you have an imbalance or a dysfunction, because integrative medicine, unlike conventional medicine, won't give you a particular diagnosis. They just know that something's just out of whack. You're overweight, you're, insulin resistant, or something's just out of balance. And so we'll use some alternative therapies, integrative therapies, to help bring you back into balance.
So that is what you would say would be the difference between integrative medicine and conventional medicine?
Yes.
Okay. So when you talk about integrative medicine, do you come upon that after a person has been diagnosed with a particular problem, or do you try to prevent them from ever having a problem in the first place? Is integrative medicine something that comes after the fact, or something that you try to instill in people before the left shoe falls?
Ideally, prevention is better. An ounce of prevention is worth, what do they say, a pound of cure. So yes, if we can catch them at that point, but most people, it just doesn't happen that way. So you end up doing it both ways. It depends on the person's perspective about health care, what they're generally inclined to do. Some people are used to, okay, you go to a doctor, I got this, they give me a pill, I take it, and that's it. I don't have to do anything except take this pill, and then I'll be at this next place. But some people really, they don't like taking pills. They want to be a part of the process, so they're willing to do some of these other therapies to help themselves feel better.
So the healing power of nature first, and then technique and technology second, is the direction in which you would prefer to lead your patients or clients, in that direction?
Let me give a little bit more clear example of the differences in the two. Let's take arthritis for an instance. If a person is coming into the doctor's office and they're hurting and they're diagnosed as arthritic, or they have arthritis, let's look at the breakdown. The first part of that word, a Greek term, arthro. And when we think about it, it is inflammation of the joint, or has to do with the joint. Then we look at itis, which is pain and inflammation. The doctor is going to treat arthritis from that perspective. And that's just what has been, we look at as the symptom. That's what they're treating. But we are responsible for finding the cause. Let's look at the cause as being a problem with calcium, trace minerals, even down to improper pH balance. When you're thinking about that, that can cause arthritis. So we're looking for the cause, and we have a unique way of determining the diagnosis or assessment, and we use blood work. So when we see that this cause is to be dealt with, we're trying to look at the deficiencies that has caused the arthritis. Does that make sense?
That all makes quite a bit of sense. So if I am diabetic, we know that I'm diabetic. Then it's a matter of right now, how serious is my diabetes? Is it something where I may be at the point where I may need to have a limb amputated? Then you have to have functional medicine at that point, because now your life is in danger. But if you catch it early enough, then you can use integrative medicine to help alleviate the problem on a long-term basis.
Well, I think we're kind of using all the terms a little bit interchangeably.
Okay.
And I want to distinguish them.
Sure.
Dr. Howard added in the functional medicine piece in his last part, because functional medicine is the part of medicine where we look at the root cause. Integrative therapies are more, most of the people who practice integrative medicine oftentimes don't always have, they don't always diagnose from the same perspective as a conventional doctor.
All right.
So when you look at it from that way, it's a little bit different. So to just kind of box them up, conventional medicine, if somebody's at the end point of their diabetes and they need an amputation, you need conventional medicine because you're in an acute state and it's life or death. So everything has an appropriate place. So in that scenario, yes, you need to see a conventional doctor. You need to get this blood sugar stable enough for you to start adding these lifestyle modifications in so that it doesn't progress to something worse.
Okay. Now, if you're at the beginning stages, if you just caught it, that's when you're able to really make a
if you're willing
impact.
to do the work of it. Because a conventional doctor, although there's also some work, but taking a pill and continuing your lifestyle as it is generally easier. Because a lot of people think, oh, I'm going to take this pill. That's what he said. I'm going to go back in. But you're going to be on this pill for the rest of your life.
Okay.
So in integrative and functional medicine, the requirement is that you're going to participate in your care. You're going to have to change some of these lifestyle factors that created the imbalance, caused that root that Dr. Howard mentioned. You're going to have to go there. Why did I get inflammation? Where did it come from? What do I need to do in my life to decrease that? So it requires that people take an active part in their health.
Do you find that a lot of people have a tendency to not want to follow through because the pill is an instant healing, for temporary healing factor, rather than maybe a long term, whereas a pill may resolve the pain for a couple of days? You may take you a couple of weeks for the integrative medicine to do its complete job. But when it does the complete job, it has a tendency of having a longer impact of healing you rather than just a temporary heal with the medicine.
Exactly. I think healing is more appropriate when you use integrative or functional medicine because it's possible. With the medication, there are side effects for medication. It has to filter through your liver and your kidneys, and they can be damaged as a result of these medications. So it's a short-term fix that actually suppresses the symptoms so it doesn't present the same way. Your blood pressure is no longer high, but you still have high blood pressure. If you stop taking the medicine, that medication, that suppression is no longer going to exist. So it's, it's not cured, it's not healed. It's just covered and suppressed for that particular time frame, the lifespan of the drug. So,
do you find that the integrative medicine has the capacity to actually heal you of some of the symptoms that you may have?
Let me give a good example.
Okay.
And I saw more diabetic patients than any other diagnosis. A diabetic patient, first of all, think in their mind that once a diabetic, always a diabetic, except they understand that there must be specific, very finite tests done to know that you're type 1 or type 2. If you're type 1, of course, you have a problem with your pancreas, and you will probably be a type 1 diabetic for the rest of your life. But if you're type 2, that can be resolved. And when I make this statement emphatically, most diabetics think once you're a diabetic, always. But a type 2, we can resolve that and you not be a diabetic any longer as far as the diagnosis is concerned. So you can change the disposition by changing your lifestyle. The hardest part that you brought out is that when people become, I use the word addictive because that's my background, to a pill, they feel that's a quick fix. But if you want to change your lifestyle and become rid of the diabetes type 2, you can. Emphatically, you can. But that's not the way it's being taught. It's being taught that since you are, do this and take this pill and that pill for the rest of your life, and you will always have that unless you are willing to change. You'll always be a diabetic.
Is there a scenario that you could give us as for a person who may have diabetes, what steps they would need to take with integrative medicine to help to alleviate them of their diabetes?
Well, functional medicine, as Dr. Howard said earlier, it gets at the root cause of the dysfunction and why they have that diagnosis. So it's going to be personalized. I could say your step would be this, but somebody else's cause of inflammation would be different. That's why they have a variety of drugs that work on different pathways in the body to treat the same diagnosis. If you have diabetes, they might put you on metformin, they might put somebody on glipizide, and they work at different areas in this cascade to actually treat the diabetes. So I have to find out through the testing that Dr. Howard also mentioned, what is your cause? Where's your imbalance? And so to say that this we would do da-da-da-da, it's difficult to say in general, but what we do in the type of practice that we have is allow the body to heal itself. We as practitioners don't heal anybody. I think that part needs to be clear. We don't do that. The body itself is meant to heal. It's a self-healing body if given the right ingredients. If given the right environment, it will do that. So what we do is create the right environment. We require that people change their lifestyle. We focus on the 5 pillars of health, and they are nutrition, fitness, stress, hormones, and detox. So when we look at all those areas, these are the areas that people are going to have to address in order to allow the body to heal itself so that they don't have diabetes anymore.
Okay, so one of the things that I hear most spoken about is detox. On every time you turn on the television, they're saying detox,
It's
detox,
popular
detox.
right now.
It's very popular, but it's been something that you have been advocating for a long time, if I'm not mistaken. So tell us, how important is detoxing?
Well, we began our process of assessment with, first of all, a lot of paperwork. We must obtain background information, current information, do some tests, and then when we ascertain that detoxing, which is necessary, we have to determine by all of the information you've given us what type detox. There are so many variations in detoxifying the body. And to fit you, as Sameerah said earlier, each one of our patients is dealt with on a personal basis. That's what I really want to emphasize in functional or integrative medicine. You are dealt with on a personal basis. I see diabetics by doing diabetic education at several of the institutions here in Nashville. I do diabetic education. We send them back to their primary care physician, and then they determine the actual what they're going to do, what pill they're going to get. But in our situation, we're going to detoxify, follow those 5 pillars, and get you to a point where the body itself is handling the problem. So detoxification is I'll say the first process, but it is determined by a lot of variables.
How receptive are your clients toward integrative medicine?
Okay. I'm going to give my numbers of years, and this is an experience that Sameerah is working into, but I'm 17 years in doing what I've been doing. The reception is, I'll say, it takes a number. I can use statistical figures and really give you some averages. But for a person to change, they have to, first of all, want to. And if they're used to taking the pill, first of all, when they come to us, they want something different. That's the difference in what we're doing and what conventional medicine is doing. When people come to us, usually they're fed up with what they've been doing. Even out of that percentage, it is a lower percentage on people who complete our program. In my 17 years, I've had representatives from, I don't want to call the names of the hospitals, to come over to my clinic and say, well, what is the reason for your high success ratio? I wasn't telling them that I saw a lot of patients, but a lot of them didn't do and didn't complete either. So non-compliance is when a patient just don't want to do what they've been taught to do. The word education is what we engage in. We try to educate a person toward lifestyle change. But if they don't want to do it or they're not motivated to do it, they're gonna go back and do the same thing. So I have them coming and going. They'll come back. I don't call, we don't badger, we don't try to instigate wrong, we don't use that. When they come back, I said, haven't seen you in 2 or 3 months. You ready to get rolling? Well, I'm ready to get rolling. I'm tired of this, Dr. Young, I'm tired. Okay, let's go. It is a lower percentage of completion. I have to be very emphatic and honest about it. If you started with maybe 10, I want to use the variable of 10, maybe only 4 are going to really comply and complete. But of the 10, they will have been educated and they will have benefited even if they didn't complete. They have knowledge now that they can pass on and it'll stay with you for the rest of your life, that I know I can do this. All I need to do is do it.
So you would pretty much say that because of this fast-paced lifestyle that we live in now, where everything is now, instant, everyone has cell phone texting, everything is just like they want results immediately.
Right.
Their level of patience has pretty much deteriorated and they want it now, so they're not willing to wait for the end results, which is normally a positive result, is that they are healed from their problems and better able to manage their problems with integrative medicine.
And what I bring, Dr. Howard's been in practice, as he said, 17 or more years. I've been with the practice, it'll be 2 years upcoming. And what we're transitioning to have a better compliance and have a better success rate is a wellness curriculum where they invest in their health and they know up front, you're going to learn how to be independent where you don't need us. We're going to teach you how to eat, how to live, how to move, how to minimize your stressors, how to keep yourself healthy, because the liver and the kidney are natural detoxifiers. So if your body's healthy, you don't have to do a major detox, you know, like we're going to have to do in the beginning, but it's just like a car. You have to do oil changes and flush the radiator and transmission. I don't know all the parts of it, but you've got to do those things on a regular basis so that the car operates, properly. And the body's the same way. Things get blocked up, things get clogged, and if you've never done that, you're not absorbing the nutrients that you're eating properly. So we got to clean the foundation up, and then you can start to heal. And
so you're building up on the ground floor up all over again, right?
Exactly.
Has that, and that, as you said, it's proven to be hard for certain individuals to maintain and stay on track to do that. But the ones who have stayed on track have seen a fundamental change.
It changes everything.
That's right.
It changes everything. And when you change somebody's life that way, it changes their family's lives. Because they see, well, what are you doing? You've lost weight and you have more energy and it changes everything, and that's the whole point. Not just to change one person, but to change a community. We have a community full of very sick, overweight, tired, and depressed people. And that's not encouraging when we look toward the future. It's just not.
No, it's not. It sounds very depressing when you say
it. And it is.
Like
and most people, that's how they end up.
True.
Sick, tired, overweight, and depressed. And it does not have to be that way. But you have to take a proactive approach to prevent that. Otherwise, it will happen.
Well, if the audience would like to get in touch with you pertaining to integrative and functional medicine, how would they get in touch with you?
We're located at this same location. That's another good thing about people like to know that you'll be there. I've been at my same location for 17 years, 1602 8th Avenue South, Nashville, Tennessee, 37203. Our number is 615-730-6904. And we work together, so Sameerah, I don't memorize the number, so I'm going to let her give her phone number also.
I'm at the same address, and my phone number is 615-379-8474.
And you have a website or email address also?
I
Yes.
do.
Okay.
info@samobilemed.com, or you can go to www.samobilemed.com. That's the website.
Okay. We have about a minute and 30 seconds left. Is there anything that you would like to tell the audience in order for them to jumpstart or get started, what they need to do, and what you would suggest?
You want to answer?
It's a new year. We're at the end of the year. Everybody thinks about these New Year's resolutions, and it's time to get started. I mean, it's, just start. Come in, talk to us about who you are, where you are. Let us help you figure out what you just take one step at a time. Just one step at a time. Pull this out. You'll be successful. Once you start to feel the difference,
Okay.
you'll be successful.
Dr. Young?
To not be sick. Sickness is something that we determine by an old order. Going to the hospital, going to your doctor when you're sick. You should not want to be sick, and that's what we do. When you come to see us, we're going to put you on a road to not need to see the conventional doctor or go to the hospital for being sick. That's what we do.
Okay. Once again, I would like to thank the two of you for being on the show. You have enlightened all of us a little bit more about what integrative and functional medicine consists of. And I would like to thank all of you for watching The Moderator, and we'll see you next time.
No more, it's none of my business.
No more, I'm sure they'll work it out.
No more, boys will be boys.
No more, I'll say something next time.
No more, why didn't she tell anyone?
No more, she was flirting with him.
No more, she's too smart to let that happen.
No more, not my problem.
No more, he didn't mean it.
No more, why doesn't she just leave?
No more, he said he was sorry.
No more, she was drunk.
No more, she was asking for it.
No more, she seems just fine to me.
No more, she should have been more careful.
No more, we don't talk about that.
No more bystanding.
No more ignorance.
No more excuses.
No more.
No more.
No more.